In this section, we will discuss how to manage your publication's compliance with the NIH Public Access Policy. I'll explain what MyNCBI is, how to log in and set up your MyNCBI account, and how to use the Awards View function in MyNCBI. The ultimate responsibility for compliance rests with the PI and the institution, and there are consequences for non-compliance. The NIH can delay your funding, place special conditions on your award, or prevent future awards for a specified time period. To ensure compliance, you will need to plan ahead. Compliance should be discussed during the planning stages of the paper, and as publication grows closer, NIH-funded authors should determine how they will comply and which authors will be responsible for which submission tasks. You will also need to use MyNCBI to keep track of your publications and associate awards with papers. Compliance will need to be monitored continuously, rather than only when a report is due. MyNCBI is a personalized account that's integrated with NCBI databases like PubMed. You may have even seen it before in the upper right corner of PubMed. You can use your MyNCBI account to save citations, save searches, and create search alerts. It also has this feature called My Bibliography, which is a place to save citations for your own publications. From My Bibliography, you can manage your publication's compliance with the public access policy. Remember, as I mentioned in the Policy Basics section of this tutorial, starting July 1st, 2013, you must use MyNCBI to enter publications into your progress reports, especially if you use the RPPR. Even if you are still using the paper PHS 2590 report, you will still need to generate the publication section using the PDF report feature in MyNCBI. So, you will need to start using MyNCBI if you haven't already. You can log into MyNCBI a couple of different ways. You can register for a MyNCBI account and log in with your MyNCBI username and password. You can log in with your ERA Commons account using the NIH login button, or you can even use your Onion. In that case, you would click on the link to third-party sign-in options and search for UNC in the list. Whatever way you choose to use, just make sure you stick with that. This chart shows the different login options and explains which one you should use. If you are an investigator with an ERA Commons account and no MyNCBI account, log in with your ERA account information. If you have an ERA Commons account and already have a MyNCBI account, log in with your MyNCBI account information and then link it to your ERA Commons account, which I'll show in a minute. If you are a delegate and do not have an ERA Commons account, you will need to create a MyNCBI account if you have not done so already. In order for everything to work properly, it is critical for the PI's MyNCBI account to be linked to their ERA Commons account. This allows My Bibliography citations to show in ERA Commons and brings the citations into the RPPR. It also allows grant information from ERA Commons to show on the MyNCBI side. Linking the accounts is also the only way to see the awards view in My Bibliography. To link your accounts, log into your MyNCBI account and then click on your username at the top right of the screen to get to your account settings. Under the Linked Account section, check to see if an ERA Commons account is listed. If not, click on the Change button. In the search box, enter NIH. Click on the NIH and ERA Commons link. Enter your ERA Commons username and password to complete the linking of your accounts. You can add citations to your bibliography by searching PubMed, or you can add citations manually, but this should only be necessary in those instances where the journal is not indexed by PubMed. Publications submitted through NIMS should automatically appear in your My Bibliography. To see full instructions on adding citations to your bibliography in MyNCBI, visit the HSL Public Access Policy Guide. The award view can be used to track your paper's compliance with the public access policy and start the compliance process for those publications that are out of compliance. You can also associate grants with citations and create a bibliography for your progress report. This is a screenshot of the display settings where you can switch to the awards view. To switch to the awards view, go into your bibliography, click on Display Settings, and then under View, choose Award, then click Apply. Notice the ERA Commons logo at the top. This indicates that this MyNCBI account is linked to an ERA Commons account. If this linkage has not occurred, you will not be able to see the option to switch to the awards view. Once in the award view, you will see these green, yellow, and red indicators next to your publications. These will tell you the compliance status of your publications. Green means that the publication is compliant. You can see the PMC ID here and that there are grants attached to this paper. Yellow means that the article is in process. We can see the NIMS ID, which indicates that this paper has been submitted to NIMS, but it is still in process. This citation should update automatically when the PMC ID is assigned. We also see that no grants are associated with this paper. Click on the Add Award link to associate a grant to this publication. Red means that the paper is non-compliant. This article does not have a PMC ID or a NIMS ID, so it needs to be submitted. Follow the retrospective compliance steps we discussed in the How to Comply section of this tutorial to get this paper into compliance. There are two more icons, the question mark and NA. The question mark means that the NIH cannot determine if this paper is compliant. This is usually because the system is not sure if the article is subject to the public access policy. For instance, this paper does not have any funding associated with it, so the system is not sure if the work is NIH funded. Click on the Edit Status link to open a wizard that will ask a few questions to determine the compliance status of this paper. The NA icon means that the paper does not fall under the public access policy. It could be too old, before April 2008, or it is not a peer-reviewed journal article, or the work was not NIH funded. For more information about the NIH Public Access Policy, visit the HSL's NIH Public Access Policy Guide or submit a question to the HSL using our Ask a Librarian service.